Natalie, for as long as IUDs have been on the market for women, there have been cries for more to be done to help with the pain.
And they can be a good option for women who are looking for a longer birth control choice or to help with menstrual complications. Dr. Natalie Gentile is here to talk about the new guidance.
Yeah.
Now, for people who aren't familiar with IUDs, because I know if you're not in your childbearing years or actively trying to pursue a family, this isn't topic A. What exactly is one?
IUD stands for intrauterine device. This is a small device that goes into the uterus and usually secretes some type of hormone to stop periods being heavy, to slow them down, and to prevent pregnancy by changing the way the uterine lining acts.
Okay.
Sometimes we can have one that's copper that doesn't have any hormones. So that's why I say sometimes there's hormones and sometimes not.
There's not. So as we're seeing this video, this is kind of how it's inserted.
Yep.
And there have been, I think with seeing this on TikTok and social media, we're seeing more and more women talk about their experiences with the pain. And some women say, like, you walk in and they've asked if you've taken Tylenol beforehand, and it really doesn't do anything to help with it.
So I just put out on Instagram just an hour ago, what are some of your stories about having IUDs? And it's appalling what I'm already getting in my DMs. There needs to be so much prep work that goes in ahead of time of having this procedure done. It's preparing the patient about what this even entails, what this looks like, what you can expect, having them pre-medicate with some ibuprofen or Tylenol for the comfort. But I think it's really that expectation setting that even begins when they walk in the office. Is the room comfortable? Is it slowly done? Are you walking a person through what is going on? And what so often is happening is none of that prep work is being done, and patients are just kind of blindsided at the pain that they're experiencing.
Absolutely. And I feel like when it comes to medical things or any procedure on social media specifically, I can only imagine as a healthcare professional, you're like, oh God, this is just not what anyone needs to see. Yeah. Isn't it amazing what women have done on social media to bring this to the forefront? Because that's where I saw it for the first time.
Yeah, so thank goodness it's being talked about, because now it's a matter of what can we do to address the anxiety, the stress, the pain. And there are some options that we now, I think, are more frequently talking about with patients. So there's the pre-medicating, like we talked about, with some type of anti-inflammatory to bring down pain. Some people will use a medication that will dilate the cervix a little bit before you even get it done. So that can, there's some studies that are, you know, for and against it, but that's one option that we've seen to at least take away some of that dilation pain that people get. There's also paracervical blocks and lidocaine. So these are things that are going to numb the cervix before the procedure.
And some of this new guidance is coming from the CDC, is that right? So the lidocaine is one of them.
Yeah, I mean, lidocaine is a pretty simple thing that can be applied to the cervix right before the procedure is done, and most people can do that in office.
My thing with something like this too is that we know this can be a longer lasting form for women. They can stay in for years, is that correct? So it can be really beneficial if you're nearing the end of your childbearing years and you don't maybe want any more children, or if you're in the very beginning and you don't want them right then. So it can be a really good option. My thing is, if it's uncomfortable, if it's painful, is it hard to then get it removed? Because I think that's the other part of this too, is that how long are you then saying, like, I need this out, and they're like, okay, we'll see you in 6 weeks. Let's give it a couple more weeks and see how you do with it.
Yeah, that's very much doctor dependent, I'd say. You know, and I think that some people say, like, oh, a female doctor is going to understand this better. That's not always necessarily true. I hate to say that. Number one. Number two, the actual removal of it is pretty simple, pretty quick, theoretically. You insert the speculum, you pull the strings, and it comes out. There could be some cramping with that. So it's really not that the procedure is hard, but hey, you've gone through this process of getting it placed. We might want to give it a little bit more time to see if you tolerate it before we now go and pull it out, right?
Right.
And I think that's sometimes the mentality of docs that we're thinking, you know, when we counsel patients.
So if there's anyone at home thinking right now, I have wanted to dive into this world, but I have heard the horror stories. What's the new guidance? What can they expect? Any relief?
Yeah, so the IUD is an amazing, very highly effective, long-lasting option for birth control. So I think it's something definitely to consider because it takes human error out of things, right? Like, it works. But just understanding that, especially if you've never had any pregnancies and deliveries and your cervix has never been dilated like that, that can increase the pain, certainly. So understanding that, you know, asking about some of these pain options, you know, pain control options is a really good idea. Doing your due diligence ahead of time of like, hey, doc, I would love if you could just talk me through this procedure.
Yes.
Talk me through this as you're doing it, you know, so that you can have more of that comfort and ease is also
what happens
so important.
After, if it's not working out for you, or the removal even of it.
Yes.
Really quickly before we wrap up, you are so active in the community and really engaging with people. You have the Active Woman panel coming up. Tell us a little bit more about this.
Yeah, so for our perimenopausal and postmenopausal women, big population that needs help, we've got got a great panel coming up on September 26th, 6 to 8 p.m. at my studio. Urogynecologist, sports medicine doc, and a dietitian.
Wonderful.
Ask them questions. You got 2 hours.
Well-rounded.
Yeah.
Great stuff.
Thank
All right.
God for
If
you.
you are interested in learning more about Direct Care Physicians of Pittsburgh or Rebel Wellness or the panel you just heard about, you can go to our website, kdka.com/talkpittsburgh. We'll have more information.